Hospitalizations have been rapidly increasing since, for sure, around Thanksgiving.
Healthcare workers have been on the front lines of the pandemic since the very beginning. With the new COVID surge, hospitals across the state are filling up once again. But is there a way to prepare in Central Texas in case hospitals fill to capacity? Andrew Lemparski has the latest.
Naya, it kind of feels like pandemic deja vu. We see a surge of COVID cases and then a surge of hospitalizations. And Central Texas hospitals tell me they're already seeing more patients. Day after day, up and up and up.
This is something we've seen before where everything is kind of fine and low-key, and then all of a sudden numbers start going up.
On Monday, Bell County upgraded its COVID-19 threat from level 3, moderate, to level 2, significant. McLennan County is seeing a case count more than 11 times higher than a month ago.
We're seeing over 100 cases, 200, 300, sometimes 400 cases per day.
Hospitals are starting to feel the effects. In a joint statement from Baylor Scott and White Hillcrest and Ascension Providence, the hospitals say, quote, "The Omicron variant is the most contagious strain we have seen yet, and the increase in cases is putting further stress on hospital staffing." Not even vaccinated healthcare workers are exempt from Omicron.
They're exhausted, and many of them may be getting sick with the Omicron variant.
Nursing professor at Texas A&M Central Texas, Amy Mursiowski, says the surge plus staffing issues could spell trouble.
All of the hospitals are looking at their plans for surge staffing, for surge space, making sure they have the equipment that they need to take care of patients. But you still have to have staff to take care of them.
In Central Texas, COVID hospitalizations have nearly doubled in a week. But for now, there's still hope that the milder COVID variant may not fill ICU beds quite like Delta did in the fall.
If you are fully vaccinated and boosted, that odds are you're not going to end up in the hospital, that you will have more of mild symptoms.
Omicron may be known as a milder variant, but it can still cause serious problems. Wearing a mask in crowds, getting tested, and staying home when you're sick are all ways to help keep these hospitals out of another crisis. Reporting in Waco, Andrew Lemparski, 25 News.